MMT, hip flexion, psoas major, and iliacus. Assist the patient to the short sitting position with the thighs fully supported on the plinth and knees flexed to 90 degrees. The patient's feet should be on the floor resting on a stool. Patient may use the arms to provide trunk stability by placing the hands on the plinth at each side. Stand in front of the limb to be tested. Passively move the patient's hip through flexion. You are not assessing the infield, you are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to flex the hip as you observe for any substitutions. Stabilize the patient at the contralateral shoulder and use your hand over the distal thigh to apply the force in a downward direction toward the floor. Please note that this is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. The most common substitutions include the use of the sartorius, which will result in slight hip flexion with external rotation and abduction of the hip, and the tensor fasciae lata, which will result in slight hip flexion with internal rotation and abduction of the hip. Make sure the patient is not leaning the trunk posteriorly to aid with hip flexion. After correcting any substitutions, ask the patient to flex the hip as previously. Stabilize the patient at the contralateral shoulder and use your hand over the distal thigh to apply the force in a downward direction toward the floor. Apply the force for a 5-second count. The force should not be jerky or sudden. It should be a gradual increase until max force is applied. Always consider the test muscle shape and size to help guide you with the amount of force you are applying. Grade 5, normal. The hip flexed to the available range of motion and the patient was able to hold against maximal resistance with no break in the position. Grade 4, good. Hip flexion holds against strong to moderate resistance. There may be some give at the end position. Grade 3, fair. The patient is able to move through all the available range of motion in hip flexion, but is unable to tolerate any resistance. If none of these conditions are met, you must reposition the patient into a gravity-eliminated position. Assist the patient into side lying by having the patient lying with the test limb on top. Make sure the trunk and pelvis are in neutral alignment and that the lowermost limb is flexed for stability. Stand behind the patient supporting the test limb under the knee. Do not support the leg at the ankle. Use the other hand to maintain trunk and pelvic alignment. In patient-appropriate language, ask the patient to flex the knee. Continue to stabilize the trunk and pelvis for any extraneous motions. Grade 2, poor. The patient completes full hip flexion range of motion in the side-lying position. If this condition is not met, you must reposition the patient once more. Position the patient supine. Stand at the side of the limb being tested. Support the test limb underneath the calf with your hand behind the knee. Ask the patient to attempt to flex the hip. Grade 1, trace. It is not possible to palpate the iliopsoas. Therefore, any partial movement is considered a grade 1. Grade 0, no motion is detected.